Hello, everyone, and welcome to Friday Findings. This is Naren's Life with MS. I am Naren, and boy, I have two very interesting articles to share with you. One that definitely shows a lot of promise, and one that regarding some of one of the news that I shared last week. It pretty much shows almost a reversal of something that I shared last week. So as a result, I hope you are all ready. So buckle your seats in and let's get started with sharing these two. So the first story I have today regards, of course, what might be the cause for MS, or what might be the best correlation that scientists have currently found. And that, of course, relates to the Epstein-Barr virus, or the EBV. And what the EBV ends up doing is, or at least this is something that scientists have theorized, is that it can actually trick our immune cells into thinking that when we are infected with EBV, that our own tissue, right, the myelin itself, is the infection. So as a result, the immune cells, right, the B cells or the T cells, most likely the B cells, because the B cells are the ones that are attacking the body, tend to not die off once they actually do eliminate the EBV from the body. Now, one thing that is definitely known is that EBV affects almost everyone in the world during childhood, and there are very few people who actually do not have EBV. So as a result, considering that a lot of people who actually who have had EBV also do come diagnosed with MS. One thing that scientists have found, is that there might be a certain issue that happens in people with MS, where the EBV actually releases certain proteins into the body that ends up confusing the immune cells, like the B cells and the T cells. T cells are the ones that actively fight any infection that occurs. And of course, the B cells are more or less the gatekeepers, the security guards, so to speak. And because EBV actually releases a certain protein that might actually confuse the B cells into thinking that the EBV still exists, the B cells continue to attack, and what they term as, or what they think of as, the EBV cells actually do end up being part of the patient's body itself, right, the internal part of the body, especially the myelin. So as a result, this is one thing that scientists are coming close to pretty much figuring out, that might be one of the reasons that MS actually strikes us. Now, of course, there are a group of people that have been tested negative for tested negative for EBV, but still have been diagnosed with MS. So there are, of course, issues with this entire thing. But if we continue along this trajectory, one thing that scientists are looking to do is trying to treat part of the immune system that actually has that confusion that yes, EBV still exists in the body, so that it can pretty much stop any damage, any inflammation, any demyelination that is actually occurring in the body, in the brain, or in the spinal cord. So there is, of course, a lot of if this thinking, or if this study actually proves to be true, this might be one of the ways that we can actually find what causes MS, or we can actually finalize or conclude as to this being one of the main reasons that MS occurs. And on top of that, this might actually lead to a new form of treatment for MS that is essentially targeting all of the B cells consider that actually consider the body as part of the EBV infected cells when it is not, the EBV infected cell. So this is, one the first story that I did want to share. Of course, you can find links, the link to this article attached. Now, one thing that I do want to share is that this study that was conducted on mice. So if we are looking to go past that, if we're looking to see if this exists for humans as well, there is a pretty long road from where we are to where we need to be to pretty much conclude the same thing existing for humans. But at least knowing that this does exist with mice does mean that there is a little glimmer of hope out there, that if this could be one of the ways that people do get infected with MS, this can be very helpful into not only finding what the underlying cause of MS is, right? Why are certain people slightly different from others, especially when it comes to EBV response, and how do we aim to stop that? And second thing, it can definitely start creating another new range of treatments that will be available, that can probably prove to be much more effective at not only combating the disease but also arresting it, and maybe even improving a patient's health over time, as treatments can be created that can reduce any confused B cells in a patient's body. So what do you think of this? What do you actually think of this study? And if you do have any thoughts about where this can lead, or what can come out of this research, do share that, right? Do share your thoughts, do share your comments, do share your insights, so that we can get the conversation started and really start thinking about if this does hold true to some extent, where can this lead us, right? So I hope you did enjoy this story, because considering the larger or the future implications of it, if all of this holds true or all of this is proven, there might be there are definitely a lot of clouds with silver linings up ahead, up in front of us, up in our future, regarding MS. So that is story number one. Okay, on to story number two. So story number two revolves around a small R&D firm, small French R&D firm called AB Science, which pretty much is developing two different forms of treatment. One of the treatments is a BTK inhibitor called Masitinib. Now, if you think that sounds a little familiar, that is because it is a BTK inhibitor, just like tolebrutinib, which we were talking about last week. Now, how is masitinib different from tolebrutinib? The first thing is that masitinib has already crossed phase 2 the second part of phase 2 and a phase 3 trial for not only not only treating progressive forms of MS, and progressive forms of MS referring to primary progressive MS and secondary progressive MS, but it has also been shown to be effective, or it has also been it's also been effective in treating ALS, which, as you know, is very it is definitely a much more a much which causes a much higher range of disability in patients. So how does this help? Well, why am I sharing this information with you? Essentially, AB Science has just gotten uh, a ruling from Japan. It's pretty much patent protection for using Masitinib for treating not only ALS, which they actually already received the patent protection for, and this is going to continue until 2037, and it can be extended to 2042, but it has received Japanese patent protection that is going to last all the way up until 2041. Now, how is this helpful? Well, first of all, knowing that, considering that I talked about Sanofi not being able to actually show positive results from their phase 2 trial of tolebrutinib, the great thing about Masitinib is that it has already gone past phase 2. It has actually passed phase 3 as well, and now it is pretty much available, or it is going to be very soon available for purchase and for treatment for people, people suffering from progressive forms of MS. So that, of course, knowing that progressive forms of MS definitely do have a lot of different issues compared to the relapsing forms of MS, and that usually when we are talking about any therapies that are used for relapsing forms of MS, it has been shown to not be as effective with progressive forms of MS. And considering that a lot of people who even start off in RRMS do end up slowly evolving into SPMS as a result of not a lot of relapses occurring after a certain point in time. So as a result, this can maybe prove to be very helpful, and it will definitely allow for a lot more companies to start thinking about also doing a little bit of research in BTK inhibitors. Now, considering that AB Science has received patent protection until 2041, at least for the treatment of uh, progressive forms of MS, means that we'll have to wait for about 15 years before the patent does end up ending, and so a biosimilar can be made. But at least it can give other companies the chance, or definitely the encouragement, to continue testing out their own BTK inhibitors to see what might be lacking. And considering that there is one company that has already passed multiple trials with this, that there is definitely there is definitely clouds with silver linings on that side as well. So that covers pretty much our second story. So of course you can read everything. I do understand that this article is actually more of a press release sent by AB Science itself. So as a result, it might not that this study, of course, still requires a little bit more time. I think there definitely needs to be uh, there definitely needs to be other studies that need to be done on it to just make sure that um, the efficacy that the researchers have pretty much said can actually be proven by individual or independent researchers. So that is definitely one thing that needs to happen. But of course, this is great news because until now, and especially after the story I shared last week, generally BTK inhibitors seemed like they might. It still seemed very much like a toss up that BTK inhibitors might be applicable to people suffering from MS. But knowing now that we have the ability to actually have people with progressive forms of MS being treated by a BTK inhibitor means that we have the ability to uh, there are patients out there that have the ability to find a certain form of treatment that might actually work for them. And also considering that this has passed a phase 3 trial, at least from AB Science's perspective, this means that the drug is also relatively much safer to use and can actually be effective in treating multiple sclerosis without maybe having that high degree of risk of all of the issues that this class of drugs pose, especially when it concerns damage to the liver. So that covers story number 2. So do share your thoughts about this. Do share your insights. Do share your comments so that we can get the conversation started. And that was story number 2. So now that we have covered both stories, what did you think about both of those stories? Do you actually feel like both of these stories or both of these studies that were conducted can actually prove beneficial either to try and find maybe a new form of treatment for MS, maybe even finding the source of MS, where MS comes from, or even finding a new class of drugs that might actually be applicable to MS patients? Because knowing that the number of patients suffering from MS is actually increasing day by day, we are definitely looking for more and more drugs that can actually be effective in treating us. So do share your thoughts, do share your comments, do share your concerns, do share your insights. I mean, if you have experiences, especially in the case that you were maybe much closer to any of these studies happening, do share any experiences you had with that as well. So with that said, I do want to say thank you so much for listening in. Thank you so much for watching. And of course, considering it is Friday and at least for India, it is going to be a long weekend, I do want to wish everyone in India a happy long weekend and, of course, an early happy Republic Day. And for everyone else, considering it is Friday, I do want to wish you a happy weekend. And I do hope that you do get the much needed rest that you need, at least considering that January is almost about to end, right? And this time next week, we will be saying goodbye to January. So you might also realize that how is this year both moving so fast and so slow at the same time. But with that said, I do want to wish you a good night, sweet dreams, and I will talk to you tomorrow. Bye.